There is a young girl who's almost totally blind. She's going to undergo surgery that might well completely save her sight, and you will see it this morning here live. Let's go to Araxia in Beverly Hills to tell us all about this. Good morning, Araxia.
Good morning, Steve. This is something I'm actually, to be honest, just learning all about. Keratoconus. I had to write it down because I keep having to remind myself how to properly say it. This is something that actually affects 1 in 500 people, and if it's not treated, you can eventually go blind. And this is Natasha. I want you guys to meet Natasha. She recently turned 18, and she's here to pretty much change her life today so she can regain her sight. Natasha, you were in school 6 months ago. You started not to see very well, and you go to the doctor. What does he tell you?
That I have keratoconus, and I can go blind from it. And I was turning 18, so it's pretty scary to know that I could be blind in my next couple of years.
And this has really affected you as far as going to school. You can't even drive right now. What do you see when you look at things?
I see double. So everyone in here has an outline, everything.
You see two of me.
I see two of you. It's like two of you.
Yeah. And I know this has been really hard for you guys, so when you found out this could be cured, there was a way to take care of this. I'm assuming you were thrilled.
It's amazing. I came all the way from the Bay Area to come to LA. I drove here, and I really thank everyone that's been here. You know, it's amazing.
All right, let's real quick bring in Dr. Brian here, who's going to perform the surgery. And this is incredible because this is a severe problem, but you're telling me 7 minutes in each eye and she's going to be okay.
Exactly. Keratoconus, just to give you a little background, because as you said, a lot of people aren't even aware of it. It's a degenerative disease of the cornea, which is the outer lens of the eye. And it's essentially like the windshield of a car. But the problem with keratoconus is that the cornea is weak. So it can no longer hold its shape. It starts to bulge out uncontrollably. And that can cause a tremendous amount of distortions in vision, blurred vision, multiple images, glare and halos at nighttime, very common for people with keratoconus. It's like basically being in a carnival funhouse, but it's no fun. And it can really rob people of the ability to lead a normal life.
Wow, yeah, this is serious. And again, if people don't know what it is, they may just not do anything about it and it'll be too late. In Natasha's case, we're catching it right in time.
We are catching it at a great stage. The Intacs procedure, which I'm going to be performing shortly, it's a 7-minute procedure per eye. We use numbing drops. Typically, there's no pain at all, little pressure. And what I'll be doing, you'll see, I'll be inserting a little tiny crescent-shaped segment underneath the surface of the cornea. That is going to help push back part of the keratoconus, and that's going to be responsible for helping improve her vision. And she won't feel the Intacs because it's under the surface. It's a little bit like dental filling for a cavity. You have a little implant in your tooth when you get a cavity taken care of. You don't even know it's there. And then part 2 of today is we're going to do another very specialized procedure for keratoconus called the Holcomb C3-R. That's going to then strengthen the cornea to help prevent it won't get any worse in the future.
Okay, and I'm going to let you get started. As you do this real quick, I'm going to talk to Mom here. Arlene, if I could grab you real quick. I know that you also, have some health issues and you've had to deal with what you're going through on top of what your daughter's going through. I know you're really nervous right now. I see it in your eyes. Just tell me what you're feeling, and the fact that you wrote a letter to Make-A-Wish Foundation. Somehow it made its way to Dr. Brian's office here. In fact, an anonymous donor, I believe, is paying for this, right? So you just found that out as well. What's going through your head?
Oh, I'm really nervous right now, and I'm really happy that she's getting this procedure done.
Did you have any idea your letter would have such an impact?
No, I didn't. No, I didn't. I'm really surprised, and I'm really grateful.
And when you started researching to learn more about this eye disease, you found out that it costs $20,000 to do certain types of procedures, and you financially just couldn't do it.
Right. And the insurance doesn't cover this at all.
So this is not only going to change her life, I know this is going to change your life. And I know you're having a hard time talking because you're nervous. I'm going to let you hold her hand and be here for support. And what we're going to do is we're, of course, going to monitor this procedure. And you guys are going to come back to me, and I'll tell you how it's going. And then, of course, the big reveal, which we're so looking forward to. She's actually going to look at the clock and give us the time, which is something she hasn't been able to do. So, Stephen, Maria.
That's a yeah, it's a wonderful story. And I like that we use the reality show, The Big Reveal, when she can see.
Yes, it will be a big reveal
for
her.
It will be. A girl who was losing her sight underwent surgery just now that we think will save her sight. Araxia is on the story with the family at this very moment. Araxia, take it away.
Hey, you guys, so exciting. Seriously, just imagine for the past 6 months, this is what Natasha's been dealing with. She couldn't really see much. Everything was blurry. Everything was double. But now you can see me, and I'm just one person, right? Yeah. So it's really exciting. The procedure was just 14 minutes in the sense that it took 7 minutes for each eye. We'll talk a little bit more about that, but why don't we show you how the procedure wrapped up just a little bit ago. And Natasha, the first thing she said when she got up was she no longer sees double. So check it out.
A little sensation there. Great. How you feeling, Natasha? That went absolutely perfect.
Okay, we're rating. Everybody has one. Everyone what?
Everybody's one.
Oh. Look at your mom. Look at your mom.
It feels good because I get to step outside and actually see a straight sign.
Yeah. What about the clock? Can you look at the clock and tell me what time it is yet?
It's 8:46, 8:47.
Wow.
Holy smokes.
That was good.
Yeah, I kind of read the numbers wrong, but I can read them.
All right, Natasha, what time is it now?
It is 9:25.
9:25, you guys. That is indeed correct. Okay, Natasha, you weren't nervous. I was really impressed. Tell me what this means for you. This is such an important moment for you in your life.
It means a lot. I can do so many things that I couldn't do when I see blurry, and I can see a lot of things now and couldn't even feel nothing.
You're going to go back to school, you can drive, and...
Yes, I can go back to school. I can finally see the board now. I don't have to be behind in work or nothing, so it's good.
And Mom, I know you're breathing a sigh of relief and you're very emotional, and you know, if you hadn't caught this in time, Natasha could have essentially gone blind, and that would have been irreversible.
Correct.
Correct. She's too emotional to talk. Okay, Dr. Brian Boxer Walker, why don't you just tell us the importance of coming in and getting your eyes checked? Because in Natasha's case, she had this from birth, and she didn't know this until she started to see bad at school. She couldn't see the board, and had she come in regularly, she wouldn't have even had to deal with this in the first place.
It's a great point, because keratoconus develops a lot of times in younger people. If your parents out there and you have a child that's complaining of vision problems, I really strongly recommend to go into the eye doctor to get checked, but also to get a cornea mapping done. That's a picture of the cornea that's able to determine if someone has keratoconus or not. If the early signs of keratoconus are found, the good news is we can nip it in the bud with this other procedure we're going to do next on her, called the Holcomb C3-R, that strengthens and prevents that weakening. So it's a really easy thing to do. It's non-invasive, both the test and the Holcomb procedure.
Okay, and you called it, one more time, just tell me, you called it a prison of...
Right, so the way I sort of looked at Natasha and a lot of patients that have this condition is that they are basically locked in a prison of keratoconus.
But now, no more.
Now she's released.
You are free. You are free, and we're so excited for you. All right, you guys, really exciting. I'm going to send it back to you guys, a moment to celebrate. Life-changing moment, that's for sure. Stephen, right now.
Terrific, thank you.